Hi, I'm Dave McKenna with Dr. Friedman and Dr. Kellerman's office at Scottsdale Institute for Cosmetic Dermatology. Today we're going to talk about FUE and FUT. So you're watching YouTube and there's 10,000 of these videos that's popped up. I suspect this isn't the only one that you're going to watch. So I'm going to try to kind of briefly touch base on some of the main differences. I literally could talk about this for an hour. So if you want to talk about this for an hour and get really detailed about it, you can give us a call and we'll put our phone number up there. And you can call me. I'll give you my cell phone number and you can call me. How about that? So today we're going to be talking about the main differences, and that's the scarring, the hair length, the number of grafts that you can get, and shaving your head and healing. Okay? So let's first talk about the scarring. With FUT, you're going to have a linear scar that will go, depends on how many grafts that you're going to get. Your hair will cover that up. I know you see some of these horror stories and you see these videos where they show a big scar on the back. That's not the reality. That's going to be somebody who, quite frankly, is inept at doing this. So if you go someplace that's what they do, hair transplants and FUT, I mean, I'm biased, I'm prejudiced, I want you to come here, but there are other places that do a wonderful job and you're not going to be left with this big gaping wound in the back. Now, with that said, the FUE is not scarless. I know a lot of people will market it as scarless, and it's not. You're going to have little polka dot scars. If you had 2,000 grafts, you're going to have 2,000 little polka dot scars, and that's just the reality of it. So there's nothing that's scarless. Now, how short can you cut your hair? With the FUE, the advantage to it is you're going to be able to wear your hair very, very short, say cut to a number 1 or 2. You're not going to be able to cut it to a 0. If you're going to cut it to a 0, just shave your head and don't worry about doing hair transplants. If you do cut it to a 0, you will see the scars. If you cut it to a 1, you're probably going to see the scars as well, but the human eye doesn't really pick it up because they're sort of diffused. It's kind of a shotgun type approach. So that brings up a good point on over harvesting. So let's talk about the number of grafts that you'll have. And if you can harvest safely with FUT, with the strip, if you can harvest safely, just let's make up a number and say 6,000 grafts. That same patient, you're not going to be able to harvest 6,000 grafts with FUE. Otherwise, you're going to over harvest. And what does that mean? That means that you'll look like Swiss cheese. You'll be able to see where all the hair was taken, and now the patient would have to wear their hair long to cover that up, which is negating the entire reason that you're doing FUE. And that's the only one reason that you would want to do FUE. And we do them both. I mean, I've done FUEs on friends, I've done FUEs on relatives. It's not a big deal, but just know the difference. So with the FUT, we can harvest a lot more grafts than with FUE. Probably 25 to 50% less grafts with FUE. So if you need a lot of work done, FUE is not a good procedure for you. If you have to wear your hair short for whatever reason, or desire to wear your hair short, FUE is definitely the way to go. Healing. So know that we have to shave the back of your head to harvest the FUEs. So however long it's going to take you to grow that out, I don't know, 2 weeks, 3 weeks, 4 weeks, I don't know where you'll be comfortable on that. Now with the FUT, we'll lift the hair up in the back and we'll trim that little area we're going to remove, and then your hair will cover that up, the scar. The scar is going to be extremely small. It's going to be, if you look at one of the lines in your hand, that's what the scar should be like. And that's, just make sure that you're having some place do this that offers you both. If you go to one place that only does one thing, that's what they're going to want to do. So it's what's the old saying, if you're a hammer, everything looks like a nail, right? So the main difference is, let's talk about the first main difference, and that's the scarring. With the scarring, there's no such thing as a scarless hair transplant. With the FUE, you're going to have a bunch, let's say we did 2,000 grafts, you're going to have 2,000 little scars. With the FUT, you're going to have one linear scar. With the FUT, you're going to want to grow your hair to a number 3 or 4 or longer. You can wear any length you want, but about the shortest you'd want to go is a 3 or a 4 so that you wouldn't be able to see that. FUE, the shortest you're going to want to go is a number 1. If somebody's telling you that you're going to be able to cut it to a 0, that's simply not the case. You'll see the scars because they're 0.8 or 0.9 millimeter punch. Whether you do it by hand or we do it with the robot, it doesn't make a difference because the punch is the punch is the punch. Let's talk about the number of grafts. If we could harvest, let's make up an arbitrary patient that we could harvest, and this is probably very, very common, maybe 6,000 grafts over the lifetime of that patient. Now that would require more than one procedure to get 6,000 grafts. That same patient, if we did 6,000 grafts, say over 2 surgeries with FUT, that same patient, you wouldn't be able to harvest 6,000 grafts with FUE. You're going to get maybe half that, 3,000, maybe 4,000. If you took, now you're sitting there going, well, wait a minute, why can't they take more? We could take 6,000 grafts, you could take 10,000 grafts. But the problem is now you're over harvesting. So if you took that same patient and you took 6,000 grafts, now the back of that patient's head is going to look like Swiss cheese. It's going to look kind of mothy. So you can take that, and you've seen videos, you've been online and you've seen over harvesting. That's all that is from taking too many grafts. So that's why you're limited. On both of them you're limited. We can only take so many grafts out of every patient. This is a finite supply. Once it's removed, it's gone. It doesn't come back. Otherwise, everybody would have a full head of hair. Next, let's talk about healing. So depending on what you consider to be healing, where we put the hair, typically up in the front and the top, that's identical whether we do FUE or FUT. The healing is the healing is the healing, and that usually takes about a week. You might have some redness for a couple of weeks, but we have a protocol here. I don't know what other people do, but here we have a protocol that we follow where you won't have any scabbing. We use hyperbaric. We used a post-wash with polysporin the following day, but that's another video. We'll get into that in more detail. So as far as FUE goes, that is going to take however long you want your hair to be. So we've got to shave that. We don't have to shave up here, but we do have to shave the back. So maybe a couple of weeks, 2, 3, 4 weeks. It just depends on what you're comfortable with. With the FUT, you'll look the same in the back when you leave as when you came in, because that section that we removed, we suture that closed, and then your hair covers that up. You won't even see that the day, like I say, the day that you leave here. So those are some of the main differences with FUE versus FUT. Here at Scottsdale Institute, we do both. So I don't have any biases, I don't have any prejudices. I don't care if you do FUE or FUT, just know what the differences are and know what the pros and cons are. There isn't any perfect procedure. You're going to have scars, you're going to have healing, there's limitations on both, so just know that. Some of the upcoming videos we're going to have are going to be on pain, so that's a real common one. People talk about the pain, the discomfort. Cost, investment, that's a big one. The other one is just the results of FUE versus FUT, 1,000 grafts versus a couple thousand grafts. Time off, how much time do you have to take off from work? We talked about scarring a little bit. Post-op care, also pre-op. We're going to talk about what we expect from you pre-op. Does the hair last forever? We're going to talk about that one. And then the number one, I think the number one, will people notice? Will people know that I've had this done? How do I explain to people? That's my favorite one. So we'll talk to you then. Take care.